If there's nothing else to add, I'd like to first move on to our first speaker of the day, who is Professor Lee Chengzhi, Professor Lee. And Professor Lee will be speaking on the topic, is focused ultrasound therapy, a new way to treat high-risk HPV infection and cervical intraepithelial neoplasia. So this is just a brief introduction for Professor Lee. She's a professor in the College of Biomedical Engineering in Chongqing Medical University. She's a director of the Research Center for Minimally Invasive and Non-Invasive Treatment of Vulva Diseases in Chongqing as well. Other than that, she's also a committee member of the International Society for Study of Vulvovaginal Disease. Professor Lee has been engaged extensively in research and teaching in Obs and Gynae for the past 35 years. She has devoted herself to the basic and clinical application research of focused ultrasound for vulva and cervical diseases for more than 20 years. And she has also accumulated a vast experience in publication, and namely 16 SCI's papers on journals in obstetrics and gynecology, ultrasound, as well as the American Journal of the Medical Sciences. With that, I would like to invite Professor Lee to deliver her first lecture. Thank you, Professor Lee.
Okay. Good evening, ladies and gentlemen. My topic is about is focused ultrasound therapy, a new way to treat high-risk HPV infection and CIN. At first, we talk about principles of focused ultrasound therapy in HPV infection and CIN. Global strategy to eliminate cervical cancer. Global strategy to accelerate the elimination of cervical cancer as a public health problem. CIN is a preeminent condition of cervical cancer. Cervical HPV had been found in up to 99.7% of cervical cancer and is implicated as a conceptual agent for CIN development. Terminal treatment of CIN is necessary to avoid its progressing into invasive cervical cancer. This table shows classification and evaluation of cervical squamous interepithelial lesion WHO classification. Treatment for CIN include expectant management and surgical treatment. Women with no-cell biopsy proving CIN1 and satisfactory colposcopy should be followed by cervical cytology screening. For women with high-cell cytology who had histology diagnosis of CIN1, most guidelines recommend a diagnostic excision. ACCP recommends that women with histological diagnosis of CIN 2 or 3 should undergo ablation or resection treatment. Treatments for CIN and HPV infection, such as cryotherapy, laser ablation, and surgical excision, are all invasive methods that may cause invasive infection. These include bleeding, infection, stenosis of the cervix, and even severe complications in subsequent pregnancies, including protein loss, abortion, protein birth, and low birth weight. Though it's important to find another infection alternative and relatively non-invasive method to treat CIN and persistent high-risk HPVs. Ideally, result compromising the patient's fertility. Focused ultrasound is a new and promising approach in clinical practice. Pfizer clinical studies had shown that focused ultrasound therapy as a non-invasive treatment for CIN and HPV infection was feasible and effective. The duration of vaginal discharge after treatment and wound healing was short. This video shows the principles of focused ultrasound therapy. The chronic beam passes through the human epithelial or physical mucous member and focused at 3 to 6 mm under the skin and the mucosa member. Focused ultrasound treatment generates high effect, clinical effects and cavitation effect that measure the disease diffuses and facilitate the local cysts and the local necrotic diffuses being replaced over time by surrounding normal health diffuses. Focused injury leads to the thermal destruction of the target diffuses at deep pace without damage to surrounding or overlaying diffuses. There are many differences between focused ultrasound therapy, the traditional invasive surgical treatment. Ultrasound engineer can directly focus on the basal layer of the epithelium through the superficial epithelial tissues, as the HPV invests the human epithelium with the basal DNA replacing in the baseline cells. It's speculated that focused ultrasound can destroy HPV virus, particularly smetarose, destroy the basal cells. Inflammatory cells and the diseased tissues are far more sensitive to focused ultrasound engineering than normal tissues. Therefore, the diseased tissues can be destroyed, while the normal tissues can keep intact. Focused ultrasound can enhance the body's and help to clean the HPV virus and help the disease tissues. Here are the characteristics of focused ultrasound therapy. Short focal lesion, non-invasive and accurate stages. Using educated complaint medium. Real-time monitor and does adjustment. Virus optimize the clinical particulars and daily standards. No smoking, light or lighting, radiation contamination. Repeatable treatment. There are the indicators for focused ultrasound therapy. Chronic subsidies with clinical symptoms and with or without HPV infection. Persistent CIN1 or CIN1 with clinical symptoms. Biopsy confirmed CIN2 or 3 with satisfactory colposcopy, especially young women with fertility equipment. Focus ultrasound is only used for patients with satisfactory colposcopy, no tumor indicated by PCT or colposcopy, and ECC longitudinal. There are the contraindications for focused ultrasound therapy. Patients in menstruation period, patients in pregnancy and lactation, acute infection of the disease lesion, cervical cancer, and ductal carcinoma. There is a lesion in the cervical corner, uncontrolled diabetes, severe cardinal pulmonary bleeding, and liver dysfunction. Preparation before treatment, cervical paper smear or PCT test to exclude patients with cervical malignant disease. Pelvic examination to exclude patients with acute or subacute inflammation of genital tract. Vaginal discharge smear to exclude patients with tracheostomy vaginal test and fungal infection. Patients should not receive other therapies within 3 months. How to carry out the focused ultrasound therapy? First, treatments were performed on days 3 to 10 after menstruation. Second, laser anesthesia, no analgesia was required. 3. After the sterile speculum was placed in the vagina to expose the cervix completely. 4th, the cervix was complete and covered with ultrasound component before treatment. The 5th, the treatment probe was applied in close contact over the tizzy and the CIN of the cervix. The 6th is moved continuously at the span of about 5 to 10 millimeters every second in a circular fashion against both the disease area in the tizzy and an addition 2 millimeters of health tissues around the treated area. The requirement time was about 120 or 300 seconds. This is a criteria of the session, the treatment. After treatment, the treated area should cervix has glass white appearance, about not to have been damaged and diluted. The cervical lesion has been contracted. The central cervical area has been retracted slightly. The second, we talk about application of focused ultrasound in HPV infection and the CIN. This table shows the clinical observation observation of focused ultrasound therapy for cervical disease in some hospital. We can see the total infective rate is about 98.7%. This is a clinical observation of focused ultrasound therapy for cervical disease conducted by Southwest Hospital. The cure rate of CIN with one treatment session is about 87.78%. This is an outcome study of ultrasound therapy for CIN. The conclusion for CIN indicated for intervention. HIFU has the advantage of causing low hard scar in local cervix and can promote the service of lesion, reduce the persistence rate of lesions, and prevent the further development of cancerous lesions. This studies infections focus ultrasound on progenies outcomes in patients with CIN or 2. Conclusion: focused ultrasound therapy is a safer and effective method for the treatment CIN or 2. It has no significant effect on the diagnosis and outcome of the patient, and does not increase the incidence of premature delivery and low birth weight babies. This table shows clinical effect of focused ultrasound therapy on no-cell statistics of efficacies of focused ultrasound therapy in 2009 to 2020 publishing the lecture. There were more than 6,000 cases of HPV infection and losing, with an average cure rate of 85%. Comparison of focused therapy with other methods. It's safer, effective, non-invasive, non-radioactive, and controllable for the treatment of cervical HPV present infected lesions. Comparison between focused ultrasound and laser therapy. Cure rate and the effective rate of focused ultrasound group and other of laser group were not significant different. Comparison of the side effect in ultrasound group and the laser group. The side effects of ultrasound therapy were significantly lower than those laser therapy. This study shows the efficacy comparison of focused ultrasound and the drug therapy for HPV infection. Focused ultrasound therapy can eliminate HPV infection in a short time, and its therapeutic effect is significantly better than interim drugs. This paper shows a clean rates of HPV with 1 year after focused ultrasound therapy or lipotherapy with HISU under 30. At 12 months of follow-up found that focused ultrasound therapy was opposite to lipo in the elimination of HPV. At last, we will show the case here. This patient is 28 years old with HPV infection for 1 year. Cervical biopsy, histological diagnosis is no cell CIN1 at 1 point. We gave her focused ultrasound treatment. This is before treatment. This is a infertility after treatment. This is after treatment through months. The cervical recovered to normal. The HPV negative. This patient with cervical HPV fact 8 infection. Cervical biopsy at 11.71. This before treatment. This after treatment 3 months. The bleeding has subsided. PCT and HPV turned negative. This patient is only 21 years old. PCT examination, no cell. HPV test, HPV 16 positive. Cervical biopsy is chronic cervicitis and focal HIFU CIN 2 or 3. After focused ultrasound treatment, 3 months. This is before treatment. This is after treatment. There are colposcopy show complete regress of the lesion. The HPV TCT negative. The biopsy showed chronic inflammation. This patient is only 25 years old. LCT shows no cell. HPV test is positive. The cervical biopsy shows CIN2. ECC is active. We give her focused ultrasound therapy. This is before treatment. This is after 3 months treatment. There is no lesion, and LCT and HPV all negative. This is another patient with HPV positive LCT asks high. Pathological biopsy is 013. ECC is negative. She was performed focused ultrasound therapy. After treatment 3, the lesion is disappeared. The HPV and TCT returned negative, and the early pregnancy was diagnosed 10 months after treatment, and the natural birth was delivered in May 2017. The physical examination of LCT and HPV is negative 42 days after delivery. We'll talk about the condition of focused ultrasound on cervical lesion. Satisfactory colposcopy, cytological colposcopy, and physiological diagnosis were consistent. There is no lesion in the cervical cancer, and adenocarcinoma will exclude. The lesion does not exclude 17% of the cervical area. Use of focused ultrasound therapy has followed the standardized clinical practice, strictly following the treatment indications. And the advantages of focused ultrasound on cervical cancers. It destroys the base layers which enable the HPV viruses so as to reduce the persistence of the HPV infection and prevent its further development into precancerous lesions. All inflammatory cells and disease tissues are sensitive to ultrasound agent. All normal cervical tissues are affected by the focused ultrasound therapy. There is no scope for necrosis processes after treatment. It also reduces the physiological and economical burdens of the patients. It is also a pollution-free operation that does not generate odors or smoking or involve burning of tissues or emission of radiation. Summary: Focused ultrasound can safely and effectively treat HPV infection and cervical lesions. Focused ultrasound can clear HPV infection in a short period of time and make cervical lesions go away with few adverse reactions and good tolerability. It provides a good choice for patients with a genetic clinical requirements for treatment. The effects of focused ultrasound therapy in treating ICL and its effect on pregnancy is further clinical observation and multi-center clinical trial.
Thanks so much.
Yeah, thanks, Professor Lee, for the very enlightening and informative presentation. I believe we have one question from the floor. So basically, the question is like this, Professor Lee, from Dr. Ina, I believe. What kind of medical therapy do you provide to patients with high-risk HPV infection in your practice?
Kind of. We use focused ultrasound in short trigger.
I see.
Dear colleagues, dear professor, my questions is about medical treatment, because in Russia we have one registration remedy. It's called D-indolylmethan. It's vaginal or rectal suppository, and we use when we have cervical intraepithelial neoplasia 1 degree, we use this remedy. But if we have CIN-2 and more, we perform destruction of cervix and additional medical treatment, D-indolylmethan.
Yeah. So I believe Dr. Ina's question was any medical therapy, correct? Other than this focused ultrasound. Yeah. So like Professor Lee, do you have any other treatment options like what the audience have asked, or is just focused ultrasound only? Or just Professor Felix would like to answer. Yeah.
Yes, I know in China,
yeah,
they also use quite a lot of interferon, and they said the result is around 70 to 80% effective in patients who have HPV infection. So that's what my understanding of some of the medical treatment they've used.
Yeah. So I hope that answers the question. Now the next question would be like, Professor Lee, can the lesions caused by HPV in the vagina be treated with the focused ultrasound as well? Or maybe Professor Felix, you would like to answer this? Like HPV in the vagina, can it be treated?
The vagina, depending on the, because the direction of the vaginal probe, you can see it's easier to touch the cervix, run and run, and it's also a few millimeter depth to the destruction. So for the vagina, sometimes can be difficult, especially for someone who is very atrophic vagina, and also when the vagina, the lesion is and a phonics at the corner. Sometimes you may not be able to touch the surface evenly, so it will be difficult. When we compare with we are using laser or diaphragm, I mean, it's much easier to operate in our traditional way.
Okay, thanks, Professor Felix. Now, because of time constraint, I'll just pass on another question, the last question, that Professor Lee, like, what are the precautions that you will take for patients after the focused ultrasound session? Or maybe Professor Felix and Professor Lee can answer together.
Yeah, I've tried to, I must say, I've used this machine and also have written a paper with Professor Lee. And from my understanding, the treatment is really non-invasive. There's no bleeding at all. The only thing is occasionally some patient may have infection of the area. So we just have to clean the vagina carefully, and then before we treat the patient, and may have to give patient antibiotic cover.
I see. So that is a very good point, Professor Felix. So like usually, like what kind of antibiotics do you use for cover after the procedure?
I usually just use the augmentin, or one of the also infection gram-negative. I use Fragile, that's metronidazole, and to treat the patient postoperatively, just for 3 to 5 days.
Yeah, that is actually a good choice, Professor Felix, because then you'll be covering the anaerobes as well as the other organisms in the vagina. So that is a very good precaution. So I mean, that is all a very good session, and thanks to Professor Lee and Professor Felix for the Q&A session.